our longtime attendees at Breaking Barriers, teams from San Diego County and their public partners have been at the forefront of community and participant-based service delivery for many years. Many of you are hopefully familiar with Live Well San Diego, for instance, and the county partners' investment in data, teaming, and service effectiveness. San Diego's partners are often guest presenters at a variety of conferences and events. I have tapped the well of San Diego's wisdom so many times on behalf of the state or other systems. I'm personally indebted to our friends in San Diego who are here with us again today to share their wisdom as they have journeyed toward a more integrated and community-based approach for much of their ecosystem. Their long bios are in your link, and I will yield to and welcome Dr. Kimberly Giardina, who's the Director of Child and Family Wellbeing in San Diego.
Thank you, Richard. Good afternoon, everyone. It's really nice to be here with everybody. As the others have mentioned, it's been pretty inspiring to hear from everybody today. So hopefully we'll add a few nuggets that have been really critical for us as we've really worked on building a countywide well-being system. I'm going to ask my colleagues to introduce themselves who are on our panel today, and then we'll jump right in.
I'm Lori Clarke, San Diego State University Social Policy Institute.
I'm Jennifer Cannell Pyle with ICF. It doesn't stand for anything, but we're providing technical assistance to San Diego in their implementation of their department.
Good afternoon, everyone. I hope the food coma hasn't set in yet. Kate Kinnamont, I'm the Associate Executive Director for San Diego Regional Center. Happy to be here.
Good afternoon, everybody. Peter Blanco. I'm with the California Department of Rehabilitation. I am out of the San Diego District, and I'm the Regional Director in that area. Nice to be here.
And I just want to acknowledge not all members of our interagency leadership team were able to be here today. So we have our juvenile court judge, who's part of our team, our tribal representatives. For those of you who don't know, San Diego County has the most number of tribes of any county in the country. So they're a really critical part of our team. We have our San Diego County Office of Ed, although some of their staff are here today. Our behavioral health services and our probation, who are also part of our team but weren't able to join us today. So we're going to share a little bit about our journey, and we have been working on a lot of this type of work for a very long time. Starting back in 1990, we had started working on lots of elements around prevention and integrated systems. Although I will say, I still think we learned a ton from Placer, who really just did an outstanding job. But for us, really began to catalyze, I think, a lot of the work in how we've envisioned it now, really starting back in 2019, when the California Department of Social Services, under the Office of Child Abuse Prevention, hosted the Prevention Summit. And we were one of the counties that had a team of 10 who went, back then we called ourselves Pursuit of Happiness, and really started to begin to develop sort of the framework of what we have built now through our system of care work and our interagency leadership team, along with many other partners alongside that. We'll talk a little bit about some work from Partners in Prevention. Want to shout out Amy Zeitz, who's here, who leads that work for us. This really came out of the Prevention Summit. We were lucky enough to be one of the 13 community collaboration sites, which is a federal grant from the Administration for Children and Families, that really focused on how we can start to do true system change to create a system of well-being for children and families, with a real focus on child abuse prevention. But really, we centered a lot of our work in early care and education components. And so that has continued and continues to grow and expand and really laid the foundation for where we're at now. We're going to be talking a little bit about some of the work that our interagency leadership team has done that most recently has sort of culminated in us. You heard me say my title is the Director for Child and Family Wellbeing. That is the new name for our department that used to be Child Welfare Services, First Five, Child Abuse Prevention, and coordination of our local child care system. So we're going to talk about how the ILT influenced all the way to shaping and changing the entire structure of our health and human services and how we function for children and families. I think it's always important, and Lori keeps us really grounded in understanding sort of the context in which we work. So I think just to kind of start, Richard talked about Live Well San Diego. This is our really big vision in San Diego of a region that is healthy, safe, and thriving. It is not owned by the county entity. We have over 550 Live Well partners across every sector who really embody efforts to really create a community that is healthy, safe, and thriving. And it's important to understand that because that has allowed us to have opportunities and access to resources, services, and supports in different ways than you might see in your communities. That we have our child and family well-being system as sort of one component of that work. We also look at work around seniors, we look around other adults, and so there are lots of components around that. We have within that our team of sort of youth, family, and community invested partners. So that includes partners in prevention. It includes a lot of other work that's happening throughout our county, but all sort of part of that work together. Kind of getting toward the middle of that is our Health and Human Services Agency, and I think it's important for people to understand that we are an integrated Health and Human Services Agency in San Diego. So I sit along 8 other service departments who work on aging, behavioral health, self-sufficiency, medical care services, housing and community development services, homeless solutions and equitable communities, and public health. So as one integrated agency working together. And that houses my team, our Child and Family Wellbeing Department. We also really have stuck to, and I think you've heard a lot today about the importance of sort of shared vision, shared mission, shared definitions. And I'm not going to read every piece of our prevention definition, but this started in our partners in prevention work and has become the guiding definition within our comprehensive prevention plan for our interagency leadership team. We didn't need to recreate the wheel, and so we really just stuck with this definition. So there are a few key components that we talk a lot about. Families thrive in connected communities, and so thinking about how we do better around those connections and forming those bridges. We want to make sure that we are aligning impact on multiple levels. So we recognize that this work has to be done at the line level, it has to be done at the community level, it has to be done at the systems level, and we're working on aspects of all of those pieces. And really making sure that we're establishing systems and structures that will create equitable pathways to wellness for children, youth, and families. So you can see the other pieces, but that has been a really driving force for us in this work. So I'm going to turn it over to Lori to talk a little bit specifically about the interagency leadership team.
Thank you, Kim. All right. Well, again, I'm one of 2 co-directors at the Social Policy Institute at SDSU, along with Steve Hornberger. And our mission at SPI is to bridge academia with government, with business, and the community to increase well-being for individuals, families, and communities. Huge mission, but it allows us to do some of the work of providing consulting and technical assistance, not just to San Diego, but to other counties as well. And Jennifer is involved in a different area of consulting to the county, and part of our role there is to integrate and collaborate, to practice what we preach and what we're trying to support going forward. So I did want to say a little bit about the role of the integrated leadership team. And Kim sort of described those rings or spheres of involvement from the outside in. I want to start from the inside out. So we have the first ever in the United States transformation from child welfare to child and family well-being department, and that is the core and the starting place for our work. Surrounding that, as Kim said, is Health and Human Services, and then there's a ring of a well-being system that goes beyond the department to include all cross-sector partners, all community partners who are youth and family serving, and the families, residents, youth, themselves. So when we're talking about well-being system, we're really talking about being inclusive at a large level. And that is the overarching purpose of San Diego's interagency leadership team, to begin aligning, integrating, and bringing those partners together in the ways that we've been talking about here. So we adopted this framework last year at the Prevention Summit statewide meeting to really zero in to 4 areas of priority for the interagency leadership team. The first is adaptive leadership. Again, it's walking the talk. It's coming together in ways that are authentic, transparent, that are not just bringing forward technical solutions to problems, but that are inviting true innovation and inviting the kind of adaptation that it takes to create a system and to move that forward. We know that we have to build capacity to achieve that vision. So part of the work of the ILT is creating those concrete goals that can achieve that. You heard already about the authentic partnership with families. ICF and Jennifer and her team are working on a part of that, and that's connected very much to the larger work that Partners in Prevention, Amy Zeitz, and the YMCA are doing. And so I think you're going to see and hear a transformation even from a focus on prevention and engaging in a preventative way to engagement through well-being and to being co-designers and co-partners in building that well-being system. And then finally, well-being metrics. Yolo, I loved your metrics around, fun and productivity and laughter. So that's definitely right on track of the kind of well-being measures that we're looking for. The earlier talk was very helpful with that as well. And you'll hear a little bit later that we're looking to use the HOPE framework to inspire some of those well-being metrics as well. And I know many of you here today are also involved with the HOPE framework. So I want to introduce some of my partners, and I'll kind of be the moderator and advance the slides here, but we want to get concrete with some of the projects that the ILT is undertaking. So in a moment, you'll hear about the crisis continuum, then our capacity building effort, and finally a fiscal work group that is looking to pull that together. So Kate.
I'm going to remain sitting down if you don't mind. Hi. So one of our interagency leadership project is this Children's Crisis Continuum project. So we are happy to share that San Diego County has been awarded through partnership with the California Department of Social Services, the funds to create this Children's Crisis Continuum pilot program. What we hope to achieve here in San Diego County is to integrate the systems that support youth so that especially youth with complex care needs so that they are able to have seamless transition between service settings and we hope to stabilize, provide treatment and stabilization to the foster youth with high acuity needs. We all know that our systems are all struggling to identify supports and pull those supports together. I love how other counties have talked about how they braid funding, and that's really what this project we hope to start with, and then sustainability is to build what other funding through other systems that exist to support this work we can pull into to help continue the work. Although the county was awarded $8 million over 5 years, and we know that money's not going to go very far, there's a lot of work and to support youth with high acuity needs. So what we hope to do is as you could tell up there, reduce the number of youth that required psychiatric hospitalizations. We want to divert those kids from those settings. And through this work, we are currently, the county's spearheading this effort, try to identify 16 intensive services foster homes for you who will serve this youth, and then provide the kind of wrap services, intensive services to help support this youth stabilize in an intensive services foster home. And we also, as part of this project, identified a care coordinator who will help coordinate all the care that this youth needs from the different partners, system partners that are there available to support the needs of the youth that are going to be selected for this pilot program. So we are already expected to January 1st of 2024 is when our target to start accepting referrals for this project. I just was in a meeting this Monday talking about what is the referral going to look like. So we're going to develop a kind of a flow chart so that our staff from different systems can follow what referrals, what paperwork. We talked about paperwork earlier. Unfortunately, that's going to be needed. What paperwork is needed to refer? Who do you refer? Who is in charge of reviewing referral? Through the interplacement committee team, that's where the discussion is going to occur. Which of those youth that are referred that are going to go into this pilot program. So that's just the first phase of this project. There's going to be a second phase, which is about a crisis residential and then sustainability of the program down the road. So the partners of this collaborative pilot program is all of the different systems that are involved and actively involved in our AB 2083 ILT group. So they have, each department have really committed themselves to this work.
Thank you, Kate.
Thank you.
Thank you, Kate. And now Peter will talk about our use of capacity building funding.
Welcome, everyone. So I'll be talking now about capacity building and a survey that we conducted for survey findings. So through this process, we found that through Medi-Cal, specialty mental health services do not adequately meet the needs of our current foster care population, especially those with complex needs. And so in particular with this survey, what we found was there's limited availability for complex needs of youth identified in LGBT. In addition, limited availability of respite care services, limited availability in intensive special health care services, as well as for children, youth with complex needs of substance use disorder. So limited availability of the MCSMHS therapeutic foster care, better known as TFC, and limited availability of intensive special healthcare services. We did see in the survey that there was some availability of occupational therapy, some level of coordination with all system partners to ensure families are supported and provided services that meet the needs of the child in care. So I'm going to go ahead now and talk a little bit about some of the capacity building proposals that came about as a result of that survey. So we have 6 listed up here. The first one is developing a professional foster parent model. The second one is proposal was for Grossmont College foster and adoptive kinship care education. So a resource parent coaching and support program. And what this would do is a resource parent placement support specialist. The third capacity building proposal that we'd like to mention is the incentive payments for STRTPs with co-occurring enhanced services and programs. Another capacity proposal building is incentives for foster family agencies, so FFAs, who can recruit resource families, especially therapeutic foster care, TFC, and Intensive Services Foster Care, ISFC, for youth and complex care needs. The fifth capacity building proposal that we came up with was funding to foster family agencies to provide support to relative caregivers. And then the sixth one is to expand access to our neurosequential model of therapeutics, NMT, recommended interventions, brain mapping, and trauma-informed psychoeducation for those in the system of care. So next, I'd like to talk a little bit about our ILT. We mentioned a little bit about our ILT fiscal work group. So we have our main AB 23, but this is part of it as well as the ILT fiscal work group. So the purpose of the fiscal work group was to identify ways we can better work across systems to share funding so that children and families can receive the resources and services that they need. So we're all at the table, all these agencies are together. How can we leverage resources? How can we leverage resources, but also share some of the funding so that we're able to meet the needs of the county? So one of the goals that we came up with was to develop an awareness of system partners' fiscal structure, available funding, resources, flexibility, and limitations. So just become a little bit aware of what each of us do at the table and in the group. Include fiscal and budget experts from system partners and collaborations to inform financial decisions and identify opportunities to braid funding for innovative solutions. The third goal that we have is exhaust all available system resources that can meet the needs of children, youth, and families. Our fourth goal of our IoT fiscal work group is to identify reasonable cost-sharing responsibilities to support the provision of timely services. And the fifth goal, which is we talked a little bit about, is braiding available funding resources. So being able to utilize each other's funding and how can we leverage and braid those fundings. And to find out a little bit more about what those fundings are and the max provision of child-centered services and the delivery of effective and efficient child-family support. So the next slide I'll talk about, continuing with the ILT fiscal work group, but just a little bit about the startup and how that went. So we secured an outside subject matter expert to help co-facilitate. Excuse me, Dave.
I think she's here, Katie.
Yeah, I think she is here.
Yes, that expert is in the room, Katie Eckert, who you heard pose a question earlier. So we don't have San Diego exceptionalism. We're willing to learn from other counties and brought Katie in to help with that.
Thank you,
So,
Kate,
thank
Lori,
you.
yeah. Well, there you go. There's my slide. No. I have a few more. But and with that, we wanted to develop a template to capture key fiscal information from each partner. As we said before, we all come from different systems, government entities, red tape, gray tape, black tape, all the approvals and paperwork. So we took an opportunity for us to really just dive in further and find out about our funding. What is the populations that we serve? What funding limitations do we have? What's exempt? What's not exempt? Can you fund this? Can you fund that? Whether it's a federal match or a certain type of allowable match, unexpended allocations, uncapped entitlement, associated share of costs, any other pertinent information. So each of our partners, we all presented during this fiscal information meeting, and they are conducted monthly. And so we continue to meet monthly to keep building on the momentum. We keep current on each other's finances, and we're starting to work on pilot projects that have been identified by the ILT team. So it's just some of the questions we put just to ponder about the ILT is, what is each partner's role? So that's something else we're talking about, not only the fiscal part, but what is everybody's role and how can we all contribute collectively towards a shared goal and shared vision? What sources of funding does each partner have to support their role? And is there a way to leverage more services or more funding through partnering together? So once the pilot is mapped out, the ILT fiscal group intends to document each partner's financial piece, including how funding is braiding, leveraged. So there is a clear audit trail. So we're also developing sort of a visual of each agency and entity, breaking it down by specifically what's allowable, what's not allowable, the populations they could serve, just understanding the funding of each entity a little bit better so that we can leverage each other's resources to support the children and family.
So thank you, Kate and Peter. What we wanted to give you a flavor of here in looking at these ILT projects is a way of working together where we really use a zoom in, zoom out approach. At the larger meeting, we'll gain perspectives across the ILT. What do you think? And take direction for work that happens in between and outside of the meeting, which is that concrete work of bringing it down, like with the fiscal work group and like with developing the proposals that then come back and get vetted and become actionable. So our whole entire framework is really geared toward action and the ways that we work together to achieve that. And so now we're going to hear from Jennifer on the development process, again with that zoom in, zoom out on the transformation of the Child and Family Wellbeing Department.
Thanks, Lori. Yes, so ICF has had the privilege of working with the County of San Diego to support their child welfare transformation into the Child and Family Wellbeing Department. We have also been working with them closely on their Family First Prevention Services integration and implementation and how that is supporting this transformation as well. I wanted to share a little bit about that San Diego is really looking, and Kim spoke to this, about integrating multiple systems of child services, including First 5 San Diego, Child Welfare Services, and other human service agency departments under one umbrella to deliver both prevention services and safety and child well-being services. ICF is supporting the complexity of this transformation. There's many stages. San Diego has been really willing and interested to slow down and really inform the process by getting staff and community input from both those with lived experience and the broader perspective of community-based organizations. Partners in Prevention has already been lifted up quite a bit, but just really want to lift up the vision for Partners in Prevention and how this work is building on that work. San Diego has been doing prevention work for many, many years, and we are just helping to support moving it forward. Also, just wanting to lift up, as has been mentioned throughout our time together in this conference, is that San Diego has really been intentional about getting input along the way. And there's been a concerted effort to get both lived experience, community, and staff input to help inform the transformation. I think San Diego did ask the questions about who wants this, and they heard from the community and helped to inform how the transformation took place. As part of the reorganizing and part of the comprehensive prevention planning, San Diego has implemented the Prevention Hub pathway, which is part of the community pathway that is part of California's comprehensive prevention planning. So the Prevention Hub is how San Diego plans to implement the community pathway option in San Diego. The hub will link families to primary, secondary, and tertiary prevention services to prevent families from becoming known to child welfare and probation. And then this also includes FFPSA-specific prevention services. The Prevention Hub is intended to be a no wrong door approach to connect children, youth, and families to services that prior, again, to becoming known to child welfare services. They can enter through self-referral, through a neighbor referral, through a community-based organization referral, as well as through schools and more traditional ways of accessing services through child welfare and probation. Once a family is referred to the Prevention Hub, the family will be provided with a care navigator who will complete an assessment and connect the families with the services that best meet their needs. I'm going to go ahead and turn it over to Kim.
So as you've been hearing about the work that our ILT has really done, and our ILT has really been a big part of informing our comprehensive prevention plan, we also started to look internally. If we're going to be part of building this community wellness system, a community well-being system, what do we need to do internally to support that change and to support the work within the ILT? So as Jennifer mentioned, we have now transformed into our Child and Family Wellbeing Department. And the vision behind this is really to be able to sort of put our money where our mouth is. If we're going to create a well-being system, then we've got to focus differently on how we serve families and really taking a family strengthening focus. That I think for many years in child welfare and probably many other systems, considering I stole this slide from our behavioral health director, who's also talked about this transformation in the continuum of care and behavioral health, all of our money goes to the crisis moment. All of our resources go to the crisis moment. In child welfare, that's foster care, right? In behavioral health, that's like hospitalization levels. That we have to flip this triangle, that we have to be investing much more in the prevention work, in the well-being work, in the, regular daily care of everybody's well-being, so if we want the outcomes to be better. In child welfare, we know that some families may still need foster care as an intervention, but what we hope to accomplish is that that is the smallest intervention that we provide to families, and that it really becomes a support to families and not a replacement for them. So as we've begun to sort of change, we also started to build a new structure for what that would look like. So we are still housed within our Health and Human Services Agency, but now rather than being multiple departments that serve children and families, we are beginning to integrate those departments all into one. So we have our Child and Family Wellbeing Department has two offices, our Office of Child and Family Strengthening and our Office of Child Safety. Under Child and Family Strengthening, that contains now First 5 San Diego. All of our child abuse prevention work, including our guaranteed income work, our comprehensive prevention plan, some work around mandated reporting that we're doing. It also now includes coordination of our local early care and education system and implementation of our county's child care blueprint. On the Office of Child Safety side, we still have the traditional functions of a child welfare system. Those didn't just go away, but with a different perspective. How are we linking better from that traditional child welfare side to what are those maybe secondary or tertiary prevention efforts that we can do a better job, either from preventing kids from entering foster care or re-entering foster care? I do also just want to highlight, we have lots of other key connections within this work. Our Child and Family Strengthening Advisory Board, many of our ILT members also sit on that advisory board, has been a really driving force of community input into this work. And especially, we have an advisory board subcommittee of just alumni and current foster youth. They're called FACES, and they are an incredible voice informing the work that has been happening in really, really critical decision-making ways. So they have been incredibly helpful to making sure that we get this transformation, which is all about them, correct. We also just like to have another visual. I'm not a visual person, but most people are. And just to kind of say this work continues to evolve. What we look like today as a new department probably will not be what we look like in 5 or 10 years, because we're also continuing to see what are those other pieces of the puzzle that we're going to start to integrate into this department. So I have a feeling next is going to be all of our home visiting programs, thinking about where we start to pull all those pieces together so that we don't have those barriers. I think Twyla said it earlier, right? When she's wears both the hat of behavioral health and child welfare, it's all her people. There's no fighting, right? So how do we do that to better serve families?
Great. And to support all of this work, we are also concurrently co-creating with San Diego a lived experience framework. We really want to land this work in the people that it impacts. So the purpose of the lived experience framework is to promote a meaningful and effective engagement with families at risk or involved in the child welfare system. It provides a structure for developing meaningful partnerships between child welfare staff and the families and youth they serve by outlining an approach that aims to integrate lived experience into all aspects of practice. The framework is currently in a draft form, but some of the elements that and guiding principles that we are lifting up is the inclusion of family voice and choice to ensure that we're getting the perspectives of the individuals that will be impacted most through this process. We're also lifting up a culturally respectful value to ensure that the process demonstrates respect for and builds on the values, preferences, and identities of each family. There's a focus on respect and dignity, that we want to treat families with respect, dignity, and cultural sensitivity, recognizing their strengths and values and their perspectives. Collaboration and integration. We've talked a lot about that throughout these days, but really wanting to highlight that individuals with lived experience are part of the full team and members who work cooperatively and share responsibility to jointly develop and implement, monitor, and evaluate the process. We've heard a lot from the community about the feedback loop, that folks are often engaged early on for input, and we're really looking at how do we keep them engaged, involved, and how do we circle back to report out what's working well. Additionally, we are working to develop a racial equity framework. This is building on work that San Diego is already doing. And the purpose of the race equity framework is, again, to really support the department's transformation into an anti-racist agency that more effectively serves and strengthens the county's most vulnerable children and families. Some of the components of the framework will include definitions, terms, concepts, guiding principles, and strategies to ensure that everybody has the same understanding and is speaking the same language.
And so as we look forward to what comes next, we also want to manage expectations. Systems change takes time. Amanda, I was loving what she said earlier about, we might not see some of these bigger outcomes change for 5 or 10 years. And so how do we set some of these smaller things we might see to let us know this is working in the meantime before some of those things change? So we're continuing to work on our ongoing alignment and have some exciting things that are happening around some of this work. Bruce Peterson from our County Office of Education couldn't be here today, but we are really working closely between our Health and Human Services Agency and the County Office of Ed. Their North Star is really rooted in the concept of belonging, really grounded in the work of Dr. John Pyle from the Othering and Belonging Institute. And that felt like a really great place for us to align and lean into as they really look at how they can reduce poverty with belonging as the foundation of that work. And of course, Health and Human Services felt like we had a role to assist in some of that work. I was thrilled that we heard earlier from Linda around the community schools, because now I don't have to explain what a community school is, but we have really leaned into working alongside our County Office of Ed around this approach. Just a few weeks ago, we actually had the first ever joint advance. In our county, we don't do retreats, we do advances because we don't go backward, we move forward. And so we had a first joint advance between the County Office of Ed executive team and our Health and Human Services executive team. And if you want to go to the next slide, Lori, just like one aha moment was like, well, gosh, we both use triangles. That's pretty impressive. Wasn't really the triangle, but all the pieces of that triangle are already really aligned. And so it's created a ton of synergy around how we move forward and support our community schools. Kate?
Sorry. So briefly, some of the ongoing alignments that we are working on as well is developing a regional healthcare team for our ILT group for the systems of care partners. This is actually based out of the ECHO model, the extension for community health outcomes from Missouri for autism, for created this evidence-based approach to support physicians. So we developed our own regional healthcare team, and one of my colleagues, Kim Stites, is leading that for as a representative from Regional Center. It's really about the ABCD approach. It's the amplify technology, best practices shared, care-based learning, and database to monitor outcomes. So that's what the goal of our regional healthcare team. We want to build capacity and increase knowledge for our staff. So the teams include a psychiatrist, psychologist. Who else do we have on the team? We have San Diego Regional Center team from our residential team. We have behavioral health services represented on the team, as well as our medical director for our adult and children psychiatric hospitals. And County of Education, Department of Rehabilitation, and Probation also are invited to be part of those teams. It's really about building capacity, understanding the needs, and monitoring the trends. What are we seeing in the youth with high acuity needs? What are the trends, and what are we gonna? What can we change about how we approach on a case-by-case basis? Because those are the kids that take a lot of resources and time from all of our systems. So we want to be collaborative and in our approach to identifying supports from the systems partner.
And one other element of the work of ILT going forward is to really focus on the HOPE framework and how that gets implemented and integrated very widely. HOPE stands for Healthy Outcomes from Positive Experiences. It was developed at Tufts University, and initially it was really framed around early childhood. But it's not a triangle, but the 4 sectors that you see there are really grounded and geared around being healthy and having well-being across the lifespan. So at the university, we're taking the lead in infusing hope for students. So part of the premise there is you don't have to wait until you're graduated to get your income, get grounded, get on with your life. It's quality of life right now. And part of that is to have an experience of leaning into those positive experiences so that the county is supporting the work of building the workforce of tomorrow. So not only will we have students who either already are parents or will become parents that use this HOPE framework, and we will also have professionals that take that into the workplace with them. And so again, sort of the embeddedness of that. The university is only one place where we're looking to be hope infused. Kim has said very widely that she's looking to become a hope infused child and family well-being department, and a health and human services agency, and a county, and beyond. So we hope that our embedded circles meet your embedded circles and leads to that one system very broadly for California. We've said a couple of times, and I think it bears repeating, which is why it's infused throughout our presentation, of looking at parent and youth voice and choice. Each one of our speakers has touched on that in one way or another, and it's just critical. And so what we mean by that is moving upward on the continuum that we saw earlier, not just to solicit input and then go away and either forget it or do what we want with it, but to bring our partners to the table, for us to go to their table so that there is true and authentic co-design. Part of that for us means compensating our partners who don't come to the table as paid professionals. So working on ways to do that. Very important that we're mindful of the power differentials. That's part of creating the belongingness and how we use power with, not power over. And finally, the fact that we want to gain and maintain perspective directly and often. We don't want to just look at the trailer and think we know the movie, right? We have to truly engage with the story and with each other in order to make that happen. For anyone that's interested in the slides, we put a few resources and documents there that we'll have for you. And I think we have a moment or two to take any questions or comments that you may have. Is there a question or comment that anyone has for the panel? Please go ahead. Oh, right here up front.
Thank you so much for that wonderful example of all of the collaboration that's happening within your county. I guess my question is, I'm curious, how does the collaboration look outside of your county? So like with your neighboring counties, Riverside, Orange County, Imperial. I just want to see how that looks like.
Are you asking how we work with them, or what does their ILT sort of look like in their county?
No, I guess I'm curious in terms of trying to have that interconnectiveness, if there's already agreements, and what kind of agreements you guys already have for those areas.
I can speak to one county. San Diego Regional Center serves both San Diego and Imperial counties. So we actually have two MOUs with those two different counties. And it's very, San Diego is a resourceful community, and because we've had existing partnership that goes for years, we're familiar with each other. We come to the table often, and the speed dials, we have our staff that are speed dial with their staff, trying to problem solve and collaborate, not just in a teaming formal process, but also offline. What can we do? It's hard to have that relationship with counties that are not full of resources, because they have other priorities on their table or on their plate. So we engage and we take what we get.
Thanks, Kate. I want to tag just one more quick example of that. So part of the benefit of having regional meetings, statewide meetings like this, is that you hear about what other counties are doing, and it's like, oh, they're doing something that would fit well with us that we're not yet doing, so we want to go and find out about that, or vice versa. So there is some interaction. In fact, we meet with another another Southern Region county on a regular basis for that reason. They're creating a wellness system. We in San Diego are creating a well-being system, and we're structured differently, so we go about that differently, but it's a true and authentic and deep peer exchange. We hear about what they're doing, what the lessons learned and what the pitfalls are, and we get to share ours with them. And I think both of the counties, just in that microcosm, have benefited from that. And I know we have a dream of doing more active peer exchange on like-situated counties throughout the state. So thank you for your question.
All right. Give it up for San Diego County's ILT. Thank you so much.